Hi, Mr. Fred.
Hi.
So, today we are going to be giving you a prescription for entropin, which is basically just dopamine. We're giving you this because you do have hypotension in relations to the sepsis that you have, and this drug will be used to help you get that blood pressure up, because if we have too low blood pressure, then your organs do run a risk of not receiving the necessary blood and oxygen it needs to survive. And we're giving you this specific one because we noticed that you have a history of renal failure, and this drug has been known to help with our renal perfusion.
Okay, so how does this drug work?
So this is an androgenic agent, which basically means it stimulates your fight or flight responses, and that it's going to basically get you it's basically adrenaline, basically. So what it's going to do is it's going to work on your beta receptors of your heart, which is going to increase your cardiac output and heart rate. And that is how we're going to get that blood pressure up. We're going to give this through an IV that we placed on you, and we are going to need to have your weight in kilograms so we can give you the proper dosaging. So before you do leave, we are going to want to get you on that scale to get that dosage correct.
Okay, so are there any side effects to this drug?
Yeah, there's a couple side effects to this drug. So the big thing is, since we are stimulating your fight or flight responses, that SNS system, you are going to be really kind of wound up. You're going to be wired, as we call it. So the big thing that we want you to do is to be in a very comfortable position. We want you in a nice, calm environment. We want your room to be very calm, no loud noises, so you have any sort of triggers that get you too amped up. Okay. We're also going to want that room to be a little bit more dimmed because it causes pupil constrictions. So if we give you that dim room, you won't have as many eye problems or blurry vision. Also, another thing we will like to have you do is, before we give it to you, we would like to have you to go to the bathroom, get rid of any urine that might be in your system, have a bowel movement, because this drug has been known to basically make you stop. Have you ever been excited before and you feel like you just can't go? That's why. Yeah. That is why.
Okay.
So we would like you to go to the bathroom before you get this drug to prevent urinary retention and that GI motility.
Okay, sounds good. So is there any time that I should call the doctor?
Yes, there actually is a couple times you should call the doctor. The big thing is since this is an adrenergic drug, you do run the risk of toxicity, sadly.
Okay.
One of the first signs of dopamine toxicity that is unique to this drug is that you get a nice little headache. The kind of term we say, it's your dopey on dopamine. Okay. So if you do have that headache, please let us know immediately. Then we can get you off this medication, get you some phentolamine sulfate, which is the known antidote for this drug.
Okay.
Also, another thing, since this is going to be an IV given drug, you run the risk of this thing we call extravasation, which basically means that there's some leaking going on at the IV site, and if it gets onto your skin, it's not very good. So if you see this or feel this, immediately call your nurse or your doctor so we can stop that fluid, and once again give you that phentolamine sulfate.
Okay.
Other than that, is there any more questions that you have for this drug?
No, you answered everything that I was kind of worried about, but thank you. I appreciate it.
Yep, no problem. So we'll get that drug started for you in no time.
Okay, sounds good. Thank you, buddy. Appreciate it.